My name's Paul Hudson. I'm the regional head for St Mungo's. I oversee the 3 Bristol Mental Health services, which are the Men's Crisis House, the Bristol Sanctuary and the Assertive Contact and Engagement. But I'm here today specifically to talk to you about the Men's Crisis House. The Men's Crisis House, it's been open for a number of years now. The key theme about it was a house which had been requested for some time by people who'd used services in Bristol. It provides an environment which is an alternative to men who might require hospital treatment, but they can choose to go to the crisis house instead. It can provide support for up to 28 days for men. People come in through a self-referral or being referred through other agencies. The key theme that we work at the Men's Crisis House is supporting men to develop strategies to help them manage their own mental health. We're not experts, but we are very good at providing people with the structure and support environment which they can learn about their own issues, learn methods for controlling those things. We have a daily group meeting. We support men to go to the Recovery College and the Wellbeing College to try and develop those skills. We also support them to develop social skills such as getting on with each other, cooking, cleaning, those sorts of things. So people access the Men's Crisis House through a telephone referral system. Most of the referrals come through either care coordinators or other supporters calling us and discussing the individual and saying that they'd like to come along to the house. We then ask questions there and then of that person, that is the person making the call, why the man wants to come in. Men can also self-refer, but when they do self-refer, we will ask for some other information just so that we can get some supporting information to understand what their difficulties are and also just to substantiate what they're saying. I think the best part I think about working within St Mungo's and working for an organisation that runs the Men's Crisis House is the empowering nature of it. We're very much focused on supporting men to find their own solutions. We're not setting ourselves up as experts. We encourage men to come in, talk about their problems, recognise what they need to do, help them find solutions. And most of the guys that come through the house do benefit from it. Of course, in some instances people find it's not what they need, but generally people get a very good experience and move on feeling much better. My role, I oversee 3 services, so I manage the managers who manage these services. I was instrumental in setting up the Men's Crisis House, so I managed the property for the first 2.5 years of its being open. I've now recruited another manager into my place while I've stepped up. My job, I think, is primarily to ensure that the services do what we're supposed to be doing. I make sure that the managers are doing what they should be doing. They make sure that the staff are doing what they should be doing. And the key thing is that we make sure our services are what clients want. Absolutely. I think what we begin to understand as time's gone on, that people's health isn't just about a one service being able to fix everything. We have to work closely together. People have journeys and people have pathways, and at different times people are going to need different types of services. It's important that we all work together to understand that someone's ill health will have a journey, and our role is to support them on a different part of a different part of their journey. Okay, it's hopeful, it's empowering, and it's realistic.